children are considered as a vulnerable population. They are still in development. Their brain, their lungs are still developing. They have a specific behavior, as I was telling. They are putting their hand to their mouth, so they are specifically exposed to the pollutants that in settled dust. And compared to adults, they ingest or they inhale a higher dose of pollutants because they inhale a quantity lower than an adult. But we always need to compare related to the body weight. So when you divide the quantity of pollutant inhaled or ingested by the body weight, this is the dose. The dose is always higher in a child because the body weight is low. So in proportion to an adult, the children are more exposed. So in this sense, it's critical. So first, children are a vulnerable population. Then second, schools as other indoor environments are buildings with many sources, school supply, a lot of furniture, cleaning products, so a lot of sources, lack of ventilation. Children spend quite a large amount of time in these buildings. This is the second place that where children are spending their time. Also in buildings, so in schools, but also in all the buildings. The air pollution stay in the buildings. Outdoor there is wind, there is rain, so the pollutants are dissolved and are removed. But in a building, the pollutants are trapped and are exposing. So vulnerable population in a polluted environment. Last thing, it's interesting because it's a learning environment. So the indoor condition must be good so that the child can learn in a good environment, and so we must breathe good quality and also see well and hear well in this building. So I presented the work done in France over the past 15 years about indoor air quality in schools. So I had two parts in my presentation. First, I presented the descriptive studies we did. We started with descriptive studies to better understand the sources of pollutants in classrooms, the type of building, the type of ventilation system. For example, I gave the example of the cleaning product studies we did to understand when are cleaning products used at schools, how often, what are the chemical substances that are inside these products and that can be emitted in the air. We showed in this study that the cleaning frequency is quite high daily in classrooms, and that some products contain hazardous substances for health, irritant substances, even one carcinogenic substances and endocrine disruptors. So it's a problematic source in classrooms that we absolutely need to reduce as much as possible and to use in a reasonable way. It was done between 2009 and 2011. So after these descriptive studies, we monitored indoor air quality in classrooms in France. We had two studies. So this large one carried out in 2009 and 2011 with only three parameters: formaldehyde as a tracer of indoor air pollution in indoor sources. We know, for example, that furniture emits a lot of formaldehyde. Then our second parameter was benzene as a tracer of outdoor air pollutants. Benzene is emitted by combustion and especially by car exhausts. And the third parameter was CO2 as a tracer of ventilation in occupied classrooms. So this study gave us a few ideas of indoor air pollution in classrooms, and it was confirmed that a lot of classrooms exceed the guideline values in France, and CO2 concentration is also rather high. It means that ventilation is poor. Then I presented the nationwide survey we carried out between 2013 and 2017 in a randomly selected sample of classrooms. The random selection of schools and then random selection of classrooms guarantee us to be representative of the school stock in France. As soon as you are based on a voluntary basis, you may introduce bias. That's why we chose to random select the schools first and then the classrooms, not to bias our sample. And in this sample of 308 schools, 602 classrooms, we did a measurement during 1 week, real-time measurements, CO2, relative humidity, temperature, also active sampling of PM 2.5 in indoor air, semi-volatile organic compounds in indoor air, passive sampling of volatile organic compounds, aldehydes, and we also sample settled dust because this is one specificity of children behavior. Children often put their hands to their mouth And with this specific behavior, they are more exposed to some pollutants compared with adults. For example, for the semi-volatile organic compounds, so this is, for example, pesticides, phthalates that are used in plastic products, flame retardants, or fluorinated compounds, polychlorobiphenyls. These are semi-volatile organic compounds. They are partly airborne in gas phase or particulate matter in the air, but they are also in settled dust because they are large, big molecules. So children are specifically exposed to these semi-volatile organic compounds. And most of them are known to be endocrine disruptors. That's why it was important to measure, to sample settled dust and to analyze these compounds in settled dust. When we summarize our results, we say we have 2 positive results and 4 critical issues. The 2 positive results are first, low concentration in nitrogen dioxide. They are below, in half of the classrooms, they are below the limit of quantification and below the indoor air quality guidelines in France. And second is the concentration of volatile organic compounds. They are lower compared with dwellings. So acetaldehyde, for example, toluene. Indoor concentration in classrooms are lower than in dwellings. So this is rather positive. The 4 critical issues are first the semi-volatile organic compound, as we discussed, because phthalates, for example, are detected in 100% of the classrooms everywhere. There are phthalates everywhere. There are also synthetic musks. Synthetic musks are used as fragrances in cleaning products, so, also in personal care products. So they were always detected. An insecticide, lindane, was detected in all the classroom as well. This is a bit problematic, as I was telling that most of these semi-volatile organic compounds are endocrine disruptors. The second critical issue was the concentration in fine particles, PM2.5, because fine particles are emitted by combustion, cooking, smoking, incense burning, and we don't have any combustion in the classroom. There is no cooking, no smoking. So we were expecting lower concentration in PM2.5 compared with dwellings, and we had the same level, 18 microgram per cubic meter, so much higher than the WHO guideline value, exceeded in all the classrooms. So this is probably due to a high occupancy, many children, so many resuspension of dust, and the proximity to a road of the school building. The third critical issue was ventilation, the lack of ventilation measured through the CO2 concentration. In France, we have proposed an index called ICON based on the CO2 concentration. As you mentioned, this study was done before COVID, so people were not familiar with CO2 and ppm. So we thought, let's have an easy way to present CO2 concentration with this index from 0, low CO2 concentration, to 5, extreme high CO2 concentration. And so in the middle, we have various notes. So 69% of the schools had an index of poor ventilation from high to very high to extreme. So in 2/3 of the classrooms, the ventilation was considered poor. And the 4th issue is lead. So lead was also measured in settled dust, and we also use wipe to measure lead. Lead, it's surprising because lead it was used in paint until 1949 in France. So then it was supposed to be not to be in paint anymore. So we were expecting to have low concentration of lead in schools. But actually, first, the school buildings in France are old. Half of the school buildings were built before 1974. Even if they were built after the ban of lead paint were still used. So we still find some lead in paint later in the 70s, for example, 70s, 80s. It was completely banned and disappeared in the 90s.